Introduction on Urinary Tract Infection, UTI. Diagnosis 1 Professor Mokhtar Kamara. Cytobacteriological analysis of the urine can be used to assess the content of. It is one of the most requested microbiological analyses in medical pathology. Urinary tract infection, UTI, is one of the most common infections. Community-acquired infection, hospital-acquired infection, is more common in women, 10% of men. 40% of women, shorter urethra. 2. Aims, check the urine for bacteria, initiate adequate treatment, rule out viral, parasitic infection. 3. UTI begins in your urinary system. UTIs limited only to your urethra or bladder can be painful and annoying. The urinary system is composed of the kidneys, ureters, bladder, and urethra. The kidneys filter waste from your blood. The ureters transport urine from your kidneys to your bladder. The bladder stores urine until it exits the body through the urethra. Any or all of these components can become infected. 4. Urinary tract infections 1/2, nephritis, damage to the nephron ureteritis, damage to the ureters cystitis, damage to the bladder urethritis, involvement of the urethra prostatitis, prostate involvement. 5. Age, sex, pregnancy, diabetes, renal disease, kidney stones, renal transplantation, urinary catheters, immune deficiency, structural and neurological abnormalities. UTI. 6. Name, gender, age. Reasons for the request. ITU's background. Concomitant disease concept. Treatment, if any, already instituted. Collection method. Collection time. 7. Morning upon waking up, first morning urination. Any time after 3 hours of abstention. No delay with bladder catheter wearer. Before any antibiotic therapy, otherwise open a therapeutic window of 3 to 5 days. Number of sample collection, at least 1 sample. 8. Ideal collection method equals suprapubic bladder puncture, SBP, which avoids any contamination by the flora of the urethra. Heavy checkmark technique limited by its invasive nature to be used in first intention. Samples, cooperative subjects, patient preparation. Sampling, midstream. Man, heavy checkmark, women, heavy checkmark, big kid. Sterile vial. 10 milliliters volume. 9. Infant, sterile adhesive pouch. Indwelling catheter carriers. Clamping the catheter, 10 minutes. Syringe puncture. Suprapubic puncture. Catheterization in women. 10. Urine equals culture medium. Avoid microbial overgrowth, the time between sampling and analysis as much as possible. Poor urine storage can lead to aberrant results, especially if the initial contamination is significant. Overestimation of bacteriuria. If treatment greater than 30 minutes after emission, store the urine immediately at 4 degrees Celsius. The number of bacteria in this case remains stable for 24 hours. 11. Too prolonged refrigeration, 24-48H. Identification of difficult microorganisms. Alteration of the figured elements, leukocytes +++. Preservatives. Boric acid ++++ inhibits microbial proliferation for 24 hours at room temperature, RT. Sodium formate stabilizes the pH. 12. Macroscopic examination, normal urine, clear color, straw yellow pathological urine, cloudy heavy checkmark, uniform heavy checkmark with filaments, heavy checkmark with deposit, hematics 13, straw yellow cloudy hematic. Bacteriuria, nitrate reductase. Leukocyturia, leukocyte esterase. Blood, protein, negative predictive value, and PV 30%. Patients surveyed. Neurologic bladder patients. 14. Qualitative and quantitative. Leukocytes, pyuria or leukocyturia. Red blood cells, hematuria. Other elements. Crystals, say oxalate, urate, phosphate, heavy checkmark hyaline, leukocyte, granular cylinders. Bacterial flora, bacteriuria. 15. Morphology and mobility of germs. Parasites and fungi. Crystal cylinders. Centrifuge 5 milliliters of urine. Centrifugation pellet smear stain. Monomicrobial flora. 16. Microscopic examination. 3/5. Crystals, parasites, and fungi calcium oxalate ammonium magnesium phosphate urates uric acid yeasts and mycelial filaments schistosoma hematobium trichomonas vaginalis 17. Microscopic examination. 4/5. Quantitative cytology. Cell count using a Malices or Nagiot cell counter heavy checkmark number of leukocytes less than or equal to 10/mm3 or less than or equal to 104/ml heavy checkmark percent neutrophils heavy check. Heavy checkmark percent lymphocytes can be done on non-centrifuged urine 18 Malices cell counter. Microscopic examination. 5/5. Qualitative cytology. Centrifuge 5 milliliters of urine heavy checkmark Cariatis smear with the pellet heavy checkmark stain the smear by GIMSA or methylene blue method. Look for leukocytes heavy checkmark neutrophils heavy checkmark lymphocytes 19 methylene blue stain. Type of media. EMB, methylene blue eosin, heavy checkmark MAC conky heavy checkmark BCP, bromocrysol purple, heavy checkmark CLED, cysteine lactose electrolyte deficient, heavy checkmark uricult chromogenic media. Presentations. Petri dish agar heavy checkmark agar slides. 20. Culture, enumeration of urine germs, EUG, submerged blade, urine dilution, calibrated loop, 10L, automatic devices and methods result, NCFU/ml of urine 21 submerged blade agar. Most used technique. Dilute 10L of urine /1 milliliter of water. Inoculate 10L 0.01 milliliters of the dilution in CLED media. Incubate 24 hours. Reading, count number of colonies. One colony corresponds to 104 germs/ml of urine. 22. Colonial morphology. Gram stain. Identification gallery. MALDI TOF. Rapid detection methods. Click to add text. Click to add text. Early detection of growth by increasing the bacterial mass heavy checkmark turbidimetry heavy checkmark bioluminescence, measurement of bacterial ATP, heavy checkmark radiometry, detection of 14CO2. 23. Uropathogens group by recognized uropathogens, Escherichia coli, Staphylococcus saprophyticus, Salmonella spp, Shigella spp. Mycobacteries 24, Group 2, nosocomial uropathogens, other enterobacteria, Klebsiella, Proteus, Enterobacter, Citrobacter, Morganella, Pseudomonas aeruginosa, Enterococcus, Staphylococcus aureus, Corynebacterium ureolyticum, Haemophilus spp, Streptococcus pneumoniae. Uropathogens, Group 3, involvement requiring high bacteriuria level, greater than 105 CFU/ml. S. Agalactiae, except pregnant women, coagulase negative Staphylococcus, and CS. Acinetobacter baumannii, Stenotrophomonas maltophilia, Burkholderia cepacia, Olagella erythralis, Aerococcus urinaris 25, Group 4, nearby urethral or genital flora, viridans and non-hemolytic streptococci, Gardnerella vaginalis, Lactobacillus spp. Coronomorphic bacilli. UTI interpretation leukocyturia / ML bacteriuria / ML possible contingencies follow-up greater than 104 greater than 105 true UTI if monomicrobial UTI diagnosis less than 104. 105 early infection sampling contamination special patient perform a second sample greater than 104 105 infection / bacterial species M tuberculosis, genital infection, infection decapitated by treatment, non-bacterial etiology special research less than 104 less than 104 non-UTI 26. Antibiotics that have urinary elimination, quinolones, nitrofurans, sulfonamides, aminoglycosides, beta-lactams, colistin, 27, 28.